Nursing Diagnosis Part 5. Disease conditions including in this video are 1. Leukemia 2. Mastoiditis mastoid surgery 3. Multiple sclerosis 4. Osteomyelitis 5. Osteoporosis 6. Parkinson's disease. Leukemia. A cancer of blood forming tissues, hindering the body's ability to fight infection. Leukemia is cancer of blood-forming tissues, including bone marrow. Many types exist such as acute lymphoblastic leukemia, acute myeloid leukemia and chronic lymphocytic leukemia. Nursing diagnosis are risk for infection and bleeding related to effects of chemotherapy, risk for impaired skin integrity related to toxic effects of chemotherapy, alteration in nutrition, and impaired mobility. Impaired mucous membranes from changes in epithelial lining of the gastrointestinal tract related to chemotherapy or antimicrobial medications. Imbalanced nutrition. Less than body requirements related to hypermetabolic state, anorexia, mucositis, pain, and nausea. Acute pain and discomfort related to mucositis, leukocytic infiltration of systemic tissues, fever, and infection. Hypothermia related to tumor lysis and infection. Fatigue and activity. Intolerance related to anemia, infection, and deconditioning. Impaired physical mobility related to anemia, malaise discomfort, and protective isolation. Risk for excess fluid volume related to renal dysfunction, hypoproteinemia, need for multiple intravenous IV medications and blood products. Diarrhea related to altered G flora, mucosal denudation, prolonged use of broad spectrum antibiotics. Risk for deficient fluid volume related to potential for diarrhea, bleeding, infection, and increased metabolic rate. Self care deficits related to fatigue, malaise, and protective isolation. Anxiety related to knowledge deficit and uncertain future. Disturbed body image related to change in appearance, function, and roles. Grieving related to anticipatory loss and altered role functioning. Deficient knowledge related to disease process, treatment, complication management, and self care measures. Mastoiditis mastoid surgery. An infection that affects the mastoid bone, located behind the ear. Mastoiditis is usually caused by a middle ear infection. This infection can result in damage to the mastoid bone and the formation of pus-filled cysts. Nursing diagnosis are anxiety related to surgical procedure, potential loss of hearing, potential taste disturbance, and potential loss of facial movement. Acute pain related to mastoid surgery. Risk for infection related to mastoidectomy, placement of grafts, prostheses, or electrodes, surgical trauma to surrounding tissues and structure. Disturbed auditory sensory perception related to ear disorder, surgery, or packing. Risk for trauma related to impaired balance or vertigo during the immediate postoperative period or from dislodgement of the graft or prosthesis. Disturbed sensory perception related to potential damage to facial nerve, cranial nerve 7, and chorda tympani nerve. Deficient knowledge about mastoid disease, surgical procedure, and postoperative care and expectations. Multiple sclerosis. A disease in which the immune system eats away at the protective covering of nerves. In MS, resulting nerve damage disrupts communication between the brain and the body. Nursing diagnosis are impaired bed and physical mobility related to weakness, muscle paresis, spasticity, risk for injury related to sensory and visual impairment. Impaired urinary and bowel elimination related to nervous system dysfunction. Impaired verbal communication and risk for aspiration related to cranial nerve involvement. Disturbed thought processes, loss of memory, dementia, euphoria related to cerebral dysfunction. Ineffective individual coping related to uncertainty of diagnosis. Impaired home maintenance management related to physical, psychological, and social limits imposed by MS. Potential for sexual dysfunction related to lesions or psychological reaction. Osteomyelitis. Inflammation of bone caused by infection, generally in the legs, arm, or spine. Infections can reach bones by traveling through the bloodstream or spreading from nearby tissue. Nursing diagnosis are acute pain related to inflammation and swelling. Impaired physical mobility associated with pain, immobilization devices, and weight bearing limitations. Risk for extension of infection related to bone abscess formation. Deficient knowledge related to treatment regimen. Osteoporosis, a condition in which bones become weak and brittle. The body constantly absorbs and replaces bone tissue. With osteoporosis, new bone creation doesn't keep up with old bone removal. Nursing diagnosis are deficient knowledge of osteoporotic process and treatment regimen. Acute pain related to fracture and muscle spasm. Risk for constipation related to immobility or development of ileus. Risk for injury. Fracture related to osteoporotic bone. Parkinson's disease. A disorder of the central nervous system that affects movement, often including tremors. Nerve cell damage in the brain causes dopamine levels to drop, leading to the symptoms of Parkinson's. Nursing diagnosis are impaired physical mobility related to muscle rigidity and motor weakness. Self care deficits eating, drinking, dressing, hygiene, and toileting related to tremor and motor disturbance. Constipation related to medication and reduced activity. Imbalanced nutrition. Less than body requirements related to tremor, slowness in eating, difficulty in chewing and swallowing. Impaired verbal communication related to decreased speech volume, slowness of speech, inability to move facial muscles. Ineffective coping related to depression and dysfunction due to disease progression. Thank you. Like, share, and subscribe.